So first of all, remind us again of what cholera is and the symptoms that you present with when you are infected.
So cholera is a bacteria, and you generally get it from drinking water that's been contaminated with the bacteria, or less commonly by eating food that is contaminated. And once you've drunk the water or eaten the food, cholera causes severe diarrhea. And it can be life-threatening. So it starts within typically a few hours. You start feeling ill and then have rapid, severe diarrhea that can lead to dehydration and death within a few hours.
So it can be treated. We're going to come back to that particular discussion. Zimbabwe has now banned public gatherings in Harare, the capital. Is that the right way to try and contain the spread of this disease?
So the underlying causes of a cholera outbreak are generally when there is inadequate safe water supply and inadequate sanitation. And those should be the primary focus of any cholera intervention to control and stop an outbreak. So provision of safe water and adequate sanitation are really key to stopping any cholera outbreak. Then there's also vaccines that the World Health Organization have pre-qualified for use during cholera outbreaks. But really, the focus is on safe water, adequate sanitation.
The disease does pass on, though, from human to human?
No. So the major route of transmission is through people drinking or being exposed to contaminated water.
So banning public gatherings may not necessarily be the solution because the source is with the water problem.
Precisely. And a health official in Harare put out a statement on the 9th of September saying that they believed the source of the outbreak was due to a burst sewer pipe that then contaminated a local borehole. So they have identified problems in their safe water and sanitation systems that are responsible for the outbreak. And those should be the major interventions at the moment.
We know that, Dr. Thomas, Zimbabwe is our neighbor. South Africans may be worried at this stage. Is there anything to worry about in as far as South African citizens are concerned, given the back and forth that you will see between Zimbabwe and South Africa?
So in 2008, late 2008, early 2009, Zimbabwe experienced a huge cholera outbreak with over 40,000 cases and 4,000 deaths. And unfortunately, that spilled over into our country. And we had just on 12,000 cases, but fortunately our death rate was much lower, but still around 100 people died. And that was as a result of people coming from Zimbabwe that had been exposed there, being sick in South Africa. But then we also have areas in the country that have inadequate safe water and sanitation infrastructure. And so local outbreaks then occurred in parts of Limpopo and Mpumalanga and even Northwest.
As a result of what?
As a result of people bringing cholera in, and then local water supplies becoming contaminated. Then other people in the community were exposed to those contaminated water supplies in our communities and became ill.
Just as a final point, you did say that it can be treated, yes, but if not treated, it can be deadly.
Exactly.
How is it treated, or what measures do those who are infected should start taking?
Right. So most people who drink contaminated water, in fact, don't develop any symptoms. And then the majority who do develop symptoms will have very mild symptoms, so a mild diarrhea. And those can typically be treated with oral rehydration solution, just as many other mild diarrheas are. But patients who develop severe diarrhea need to go to healthcare facilities urgently because they require drips with fluids to replace what they're losing, and also antibiotics to treat the infection. So as long as people present early to healthcare facilities, it's readily treatable.